Welcome to This Explainer. Today, we're diving into a really fascinating but also pretty heartbreaking dual-sided history of British child welfare. We are going to explore a tale of high society philanthropy that was operating right alongside a totally hidden, systematic program of exile. It's an incredible story of generosity, devastating deception, and honestly, the extreme lengths a society will go to when faced with an overwhelming crisis. To really grasp this, we gotta kick things off with a fundamental question. What actually happened to Britain's most vulnerable children? See, starting in the 1700s, Britain was dealing with a massive, unprecedented crisis. Cities were absolutely booming, poverty was rampant, and the number of destitute, abandoned kids on the streets was just staggering. Plus, illegitimacy carried this deep, life-ruining stigma, especially for unmarried mothers. So, how did the empire handle this? Well, the answer splits into two wildly different paths.
Section 1. The Foundling Hospital, a domestic solution.
Okay, let's start with the first path, a celebrated domestic solution known as the Foundling Hospital. Established in 1739 by a philanthropic sea captain named Thomas Coram, the goal here was the education and maintenance of exposed and deserted young children. And just a quick note, the word hospital back then, it basically just meant hospitality for those less fortunate. What's absolutely crucial to understand is that this institution was a literal lifeline for the children of unmarried women facing total societal ruin. Interestingly, the hospital prioritized the kids' physical health over formal education, maintaining a strictly disinfected environment just to fight off diseases like smallpox and dysentery. The admission records from this time they're really hard to read. At first, the hospital didn't ask any questions about the parents. But mothers, desperate to one day find their babies again, would leave these identifying tokens. We're talking marked coins, playing cards, little verses on scraps of paper, or unique pieces of fabric. The phrase, paper on the breast, clout on the head, is an actual historical entry detailing exactly what a baby was wearing when dropped off, recorded in the desperate hope of a future reunion. But here's the thing. The sheer scale of the poverty problem was way too much for them. Between 1750 and 1755, over 2,500 children were brought to the hospital, but they only had room for 783. Since private funding couldn't keep up with the overwhelming public demand, they had to adopt a literal balloting system. Mothers would draw balls from a bag, red, white, or black, to determine if their child would be saved from the streets. Later on, Parliament actually stepped in to fund a period of unrestricted entry, and it was a disaster. 15,000 children poured in, which sparked this horrific, cruel trade of vagrants charging money just to transport babies from the countryside.
Section 2. The Fashionable Charity, High Society's Cause.
Now, despite the struggles, the Foundling Hospital wasn't just any charity. It became the fashionable cause of the day. It has some seriously heavy-hitting supporters. King George II signed its royal charter. The legendary painter William Hogarth not only designed the kids' uniforms, but set up a permanent art exhibition there, which, fun fact, became Britain's first ever public art gallery. And then you have the composer George Frederick Handel putting on annual benefit concerts of his famous Messiah oratorio right in the chapel. So artists and royals basically turned this orphanage into a high society hotspot to drive up massive donations. Section 3. The Home Children, the Dark Pivot. But while all that beautiful music was playing and high society was patting itself on the back, a much darker child welfare system was operating in the shadows. This brings us to the home children. This was a massive child migration scheme. Technically, it started in the 1600s, but it really ramped up in the 19th century, and incredibly ran all the way into the 1970s. Under this program, children were systematically sent away from the UK to colonies like Canada, Australia, New Zealand, Rhodesia, and South Africa. The logic was cold and simple. To relieve welfare strain at home and solve a cheap labor shortage abroad, Britain just exported its vulnerable children across the empire.
The gap between what was promised and what actually happened is truly horrifying. The stated purpose, pushed hard by pioneers of the scheme like Annie Macpherson and Maria Rye, was all about education, training, and giving kids a humanitarian escape to a land of opportunity. But the grim reality? Upon arrival, these kids were immediately exploited for cheap agricultural labor, forced into domestic servitude, and subjected to rampant institutional abuse.
Section 4. The Data Shock, Uncovering the Numbers. To really wrap our heads around this, we have to look at the numbers. 150,000. Over a period of 350 years, an estimated 150,000 children were dispatched across the globe. Just think about the logistical scale of that for a second.
Tens of thousands of kids loaded onto boats and shipped across oceans, far away from everything they ever knew.
But honestly, this next number is even more shocking: 88%. The general public was totally led to believe that these migrant children were orphans. But in reality, 88% of them had living parents. Because of severe poverty, many parents had just temporarily placed their kids in care, completely unaware that their children were being shipped to the other side of the planet. Some families were even lied to and told their kids had been locally adopted.
So, as you can imagine, the psychological toll was just devastating. Stripped of their identities, these kids were routinely deceived, literally told their parents were dead. Once they landed in the colonies, they were cast adrift, handed over to harsh taskmasters who completely denied them the shelter and education they were promised. Many ended up in religious schools and institutions where they faced systematic abuse, which of course sparked countless runaways and a huge amount of hidden suffering.
Section 5. The Modern Reckoning. You know, the craziest part is that the government actually knew early on. Way back in 1874, an inspector named Andrew Doyle wrote a scathing report condemning these careless placements in Canada, pointing out that kids were just being overworked. But the practice continued anyway. It wasn't until 1987, more than a century later, that a British social worker named Margaret Humans fully exposed the whole scheme and founded the Child Migrants Trust to help reunite these fractured families. Her relentless work finally forced a global reckoning. This led to formal apologies from Australian Prime Minister Kevin Rudd in 2009 and UK Prime Minister Gordon Brown in 2010, who openly called the policy shameful and set up a £6 million compensation fund.
So why does all this matter to us today? What's the big takeaway? Well, the impact of this is etched right into modern demographics. Incredibly, it's estimated that 1 in 10 Canadians today is a descendant of a home child. 10%. That is a foundational piece of modern Commonwealth history, directly tied to exiled British youth that just went completely unspoken for decades. As we wrap up this explainer, looking at the absolute stark contrast between the glamorous, art-filled halls of the domestic foundling hospital and the cold institutional exile of the home children, we're left with a really heavy question. How do we actually make amends for a stolen generation? Apologies and compensation funds are a start, sure, but the echoes of these policies are still actively felt in thousands of families right now. I highly encourage you to look deeper into the stories of the home children and just consider how the complex legacy of child welfare continues to shape the world we live in today. Thanks for joining me on this explainer, and I'll catch you next time.